Hello, thanks for joining us today at the lab here at the World Egg Bank. Seeing as we are a bank, I wanted to show you our cryo area first. We have a dual monitoring system here. The first on the left there is the CryoSafe Sensiphone Express 2, which is an internal temperature monitor. And then to the right there we have the Cryo Sentinel, which is an infrared system, and that monitors exterior temperature of the tanks. And here are some of our tanks. And we'll move into the lab here. So our gases come in through the wall. Got our incubators there. This is our cryo station here. Everything gets vitrified on this table here. Air purification. We have our manipulators set up so we can take pictures, and we do make embryos. So we'll do those there as well. And then our retrieval station. This is a very quick tour of our lab. Thanks for joining us.
Brian, I think you're muted.
Thanks for creating this forum and for inviting me to be a part of it today. I am Brian LoManto. I'm the lab supervisor here at the World Egg Bank. So I'm going to discuss briefly cryopreservation in-house versus manufactured solutions. Next slide, please. So when thinking about using a manufactured cryopreservation solution versus one prepared in-house, in the interest of brevity, I'm going to examine only what I deem to be the most critical procedural elements. We'll do that so that you can make your own decisions from there based on your individual lab's needs and available resources. So first and foremost is the standardization of constituents. Manufacturers have very precise methods for measurement, ensuring lot-to-lot consistency, and they also must follow stringent regulatory controls governing their manufacturing process. Therefore, controls throughout their process occur with a level of precision that's not so easily reached when preparing media in our labs. It makes manufactured media more predictable with respect to solute concentrations. Solutions made in-house can be subject to increased variability based on factors such as the balancer pipette calibrations, technician competence with the level of precision required, among others. However, with properly trained staff and well-maintained equipment, this can be overcome. So next we have quality assurance testing with each lot. QA testing, as we see on our certificates, it's multifaceted. So first there's bacterial and fungal testing. The agar plate requirements for bacterial testing alone can vary based on the type of bacteria being tested for. You could use selective or differential growth media. Then there are also biochemical tests as well. Gram staining, catalase test, substrate utilization tests. Fungi require different substrates to test for their presence altogether. So this type of testing, it's definitely critical for formulating an effective, high-quality medium, and it requires time and resources to accomplish in-house. Endotoxin level testing is another type of QA procedure that's standard for manufactured media and should also be required for any in-house production. The most common method is the LAL, or the Limulus amoebocyte lysate assay. It's highly sensitive for endotoxin levels. Availability to do this test or any other sensitive measure of endotoxin testing may not be readily available in your lab, which would then require sending out a sample of media to a reference lab. Next is the good old-fashioned bioassay. Most of us equate that with the mouse blast development or sperm survival. This is pretty straightforward to perform in-house, and it's also completed by media manufacturers. The last aspect of QA testing is pH and osmolality. These are critical factors that cannot be overlooked. Most of us have a pH meter, but most of us don't have access to an osmometer. Investment in equipment is a factor when deciding whether to formulate your own solutions. Also, all pH meters are not created the same. The meter used for this task should be high quality and reliable. The last, and some might say the most important aspect to consider when deciding to manufacture media in-house or to purchase through a commercial supplier is the staff who you will be using as your alchemists. Increasingly in today's IVF lab, time is a factor for everyone. Properly formulating and testing a critical solution, such as cryopreservation media, requires time, resources, and training. Does your facility have a highly trained individual capable of accomplishing this procedure with what should amount to good manufacturing practice? Do they have the time available in their busy schedule of day-to-day IVF? Do they have adequate resources, such as high-quality chemicals, purified water systems, osmometers, and bioassay materials to produce a high-quality finished product? And then there's other questions that you can come up with to determine if in-house media production would be right for your lab. If the answer to any of these questions is not a response conducive to a quality product, producing your own media may not be the right fit. In the end, the decision to use in-house versus manufactured media is a decision each individual lab should make based partially on the factors that I've just discussed, but also on factors unique to your lab. In our lab, we use commercial media mostly based on staff time. It's become unnecessary for us to formulate a potentially variable media when there are high quality, viable, and more importantly, familiar options not only